Hugo said, "Nothing is more powerful than an idea whose time has come." And today is certainly that time. Fernandez, in its 75th year of existence, a lot has happened. Bear with me while I do my best to take you through significant moments of these 75 years over the next several minutes. Lourdes and Leslie, our founders, stepped into the unknown in 1948 when they set up an inpatient maternity practice with 2 beds. They laid the foundation for us with values that stood the test of time. Life comes from God, they firmly believed. Respect life and support and respect each other. Service before self. Never turn away a patient purely for financial reasons. Do what is right no matter what the cost. And build trust by remaining honest in all transactions. Issues related to finance, patient care, and employee benefits. All of this is built on a solid foundation of compassionate, respectful care. In 1985, my parents handed over the reins of the hospital. At the time, had 40 beds. The hospital cared for patients from different disciplines: orthopedics, ENT, general medicine, general surgery, and maternity services. However, I felt called to set up a center of excellence for maternal and newborn care. I wanted to build an institute where every pregnant woman felt safe when she entered our doors. The focus was to keep care for mother and newborn under one roof, and she and her baby would be the center of all our decisions. Everything we then added over the years was built around this mother-baby dyad. There was absolute clarity of thought and vision. The team was then built, and for the first time, a neonatal intensive care unit was set up within a private maternity hospital, and I'm told by Pramod that was actually the first time this happened in the city. We did not want the mother and her newborn to be separated. All care needed to be offered under one roof. Today, we see dedicated maternal and newborn units mushrooming all over the country. In 1992, Fernandez Hospital Private Limited was set up as a company to build the institute. Our flagship hospital of 100 beds at Bogulkunta was inaugurated on the 25th of August 1996. Fast forward, by 2000, we had grown into a tertiary perinatal referral center. Very sick mothers with multi-organ failure were referred to us for further care. This was certainly an endorsement by our obstetric colleagues of trust within this team that was working at Fernandez. This then led us to set up a dedicated obstetrical critical care unit, the first of its kind in the country. The Prerna anesthetic team, neonatologists, OBGY specialists, and physicians worked together to carve evidence-based protocols to help run this unit. Today, the Government of India has set up high-dependency units and critical care training modules for all maternal and child health centers across the country. The National Board of Examinations in 2000 also recognized us as the first national training institute for high-risk pregnancy and perinatology. We were the lone institute for about 11 years. And today we are so delighted to know that 8 other institutes across the country have been added. And now we all work together with Dr. Tara from Fernandez, leading and coordinating all the education and training. So we went into training in different departments, and today we've become a national sought-after training center in 4 disciplines: OBGY, neonatology, midwifery, and anesthesiology. In 2007, we felt the need for a hospital dedicated to high-risk, complicated pregnancies, and the Hyderabad Hospital was inaugurated in December 2010 and opened its doors to inpatient care on the co-founder Leslie Fernandez's birthday, 8th January 2011. How strange and how uncanny. The obstetric medicine was set up. Once again, the first of its kind in the country, where anesthetists, physicians, OB/GYN specialists, neonatologists, and other specialists came in whenever needed to help make pregnancy and childbirth safe for women. These were women where the mother or the baby in the womb had complications. This attracted the attention of colleagues across the country, and they came to spend time with us, observing, learning, and taking away what they wanted to introduce in their own hospitals. In 2016, Stockholm, where we are today, was launched to help cater to patients on this side of the city. As you can see, we remain steadfast in our commitment to making pregnancy and childbirth safe for every woman. And I stress on the fact that we said every woman. Fernandez has enjoyed the privilege of serving women across the entire socioeconomic spectrum. Maternal and newborn care formed the core of our work. Other allied disciplines were added over the years. But in the last 15 years, and more so in the last 10 years, we became acutely aware of childbirth facing a crisis. And this is a global phenomenon. Pregnancy and birth became medicalized. C-sections began to rise all over the world. Induction of labor was the norm, and women were certainly not happy being coerced into accepting options they were uncomfortable with. Something was wrong. We seemed to have forgotten that pregnancy and childbirth are natural events, and women must enjoy their journey to motherhood. In 2011, Fernandez launched the first in-house professional midwifery education and training program, popularly known as PMET, and it could not have been timed more appropriately. We wanted to build this unique cadre of professionals as a first step to help prevent avoidable maternal and newborn deaths in our country. At that time, our maternal mortality ratio was unacceptably high. However, this journey of midwifery taught us obstetricians about woman-centered, respectful care. The midwifery philosophy rests on one simple truth. Pregnancy and childbirth are natural, but significant events in a woman's life. Every woman must be empowered with the proper knowledge to help her enjoy this journey to motherhood. It is her fundamental human right, we discovered, to be offered the highest quality of care in an environment where compassion, respect, dignity, and privacy are ensured. And more importantly, her choices respected. This is the heart of midwifery. We were convinced we had lost this plot. This was our light bulb moment as an organization. This was the time we then decided we need to be dedicated. We had to change. We had to do things differently because our focus was always maternal and newborn care. We made it our mission to ensure every woman under our care was offered this experience. Volumes of research showed that midwives trained to global standards should be the primary carers for healthy, low-risk women, while obstetricians care for women with complications, thus firmly establishing the collaborative model of care. While we took pride in believing that Fernandez had the best team care in India, this called for a new working relationship and had to be built on mutual respect and trust. It led us to create a whole new pathway of care. We reviewed our childbirth practices. We sat down with neonatologists, reviewed all that we were doing during labor and birth. We did a 180-degree turn. We unlearned and we relearned. Today, in our 75th year, we remain very clear. We are called to make pregnancy and childbirth safe. We are called to ensure every birth experience for the women we serve will be blissful. The definition of the word blissful: providing perfect happiness or great joy. Yes, no matter what the mode of birth is, should she have a water birth, she may have a natural birth without any medication or interruption, she may have a C-section, she may have a forceps birth, but the whole experience of bringing new life into the world must be safe, respectful, and joyous. This is what we do. This is why we do it. And this is why we believe we are built for birthing. How do we do this? Collaboration between midwives, obstetricians, and gynecologists forming the backbone of our services, supported by our neonatologists and all other specialists wherever and whenever they are needed. That perfect collaboration with respect and trust interprofessionally is our unique selling point. Every service we go on adding is built around this mission. A few words on Fernandez Hospital Private Limited, which was set up in 1992 as a private limited company. I was given the privilege of being employee number 1, and I continue to remain so. At no time was the profit from this company distributed to its directors as dividends. After paying our taxes, every rupee was plowed back. In that sense, it was running as a not-for-profit. So it was no surprise when in 2018, we decided to legally register ourselves as a Section 8 not-for-profit company and set up the board of directors with 5 very diverse, distinguished, and accomplished individuals whom we are privileged to have on our board. Bear in mind that while our avatar may have changed, our values remain the same, and our focus on the pregnant woman and her newborn continues, perhaps with more vigor. As an organization with a mission and a clear purpose, disruptive thinking has been our USP. Some examples of which I would love to share with you. To stay self-funded, to have a protocol-led team practice, no stars here. All of us are salaried employees. To do what is right, no matter the cost. Kangaroo Mother Care is a perfect example. With us introducing Kangaroo Mother Care, all our revenue from neonatal intensive care units dropped. Human Milk Bank. Human milk is offered to premature babies free of cost, while it costs us enormous amounts to run it. Midwifery to promote natural birthing and reduce unnecessary interventions, including cesarean sections. Hospital stay is further reduced. Striving always to optimize costs by using technology. Using our growing volumes to teach, to share all we know without holding back. Partnering with the government to give back to the community, to train both in Fernandez and in public hospitals. And that's a privilege we handle with great responsibility. So all that we do is built on the values embedded by our founders: compassionate, respectful care. But then, all this would not have been possible without having the full support and trust of my family, friends, and well-wishers, persons who believed in this philosophy. I also acknowledge the many individuals who walked with us for 30 years and more. We have 8 of them present with us today. Gauri B, 45 years. Dr. Kasturi, 42 years. Dr. Mohini, 34 years. Talat Inayat, 34 years. Daya Swarupa, 33 years. Dr. Shashi, 33 years. Dr. Geeta, 33 years. Sister Regina, 30 years. What more can I say? My heart is bursting. We are blessed to have colleagues, our employees, who embody our values every day, helping build a culture where team spirit, concern, compassion, and respect for each other abounds, no matter what position you hold. This was particularly evident during the in-house cricket matches. You had a security guard who could be the captain, and you had doctors on his team. Also during our annual functions, hospital day functions, and during emergencies where no hierarchy exists. I am particularly grateful to you for standing by us during the pandemic. I received WhatsApp messages, emails, text messages, some of you offering not to accept salaries for a few months, a lot of you wanting to accept less salaries to help us through those difficult times. Sacrifices were made at all levels. It has certainly been a privilege and a matter of great pride to lead Fernandez and enjoy your unquestionable loyalty, support, and love. Every award given to any of us over the years is simply a recognition and endorsement of the collective work done by every individual, sharing a common focus. I have no personal wealth in terms of gold and diamonds except this gold chain with a cross. But I've always felt the wealth of Fernandez lies in its people. The security guard who runs to fetch that wheelchair for the mother who's coming out of the car. The valet driver who refuses a tip when a client wants to give him money. The frontline person who walks that extra mile to calm an overly anxious mother. The healthcare worker, be it a housekeeping person, a nurse, a doctor, a midwife, who stays beyond her call of duty, beyond her working hours, to help support us through emergencies. The doctor who endorses a waiver on the bill, knowing that his request would be honored when he knows that there are patients who cannot pay a bill. I could go on and on. But today, we thank God for our founders, Leslie and Lourdes Fernandez. We also remember with deep gratitude and love those who have passed on, people who gave of themselves to help build this organization, faces and names too many to mention, but whom we will never forget. Today we celebrate each member of the Fernandez Foundation family. I take this opportunity to thank you for investing in Fernandez Foundation. May each of us take pride in what we do and find joy in helping make pregnancy safe and birth a blissful experience for every pregnant woman we are privileged to serve. After all, over the past 75 years, we focused on just that. We are therefore not surprised to find today that we are indeed built for birthing.